Hi, I'm Dr. Dean Kelaita, Calaveras County Health Officer. We're here at the county's Emergency Operations Center doing Facebook Live today to give you an update on novel coronavirus or COVID-19. To date, we have 2 confirmed positive cases of COVID-19 in Calaveras County. There are no additional positive cases at this time. Calaveras County Public Health staff continue to conduct investigations and in coordination with local healthcare providers, recommend testing for any suspected COVID-19 cases. Calaveras County Public Health staff continue to work diligently on case investigations to support widespread community efforts to slow the rate of transmission of COVID-19 and the potential impact to the community. Calaveras County school officials, in coordination with Calaveras Public Health, announced the closure of all schools. The schools are tentatively scheduled to reopen on Monday, April 6th. This decision will be finalized after reevaluation of the situation at that time. Calaveras Public Health urges people to avoid all gatherings, non-essential travel, private social, and practice social distancing. The governor has asked for statewide closures of bars, wineries, nightclubs, and brew pubs. Restaurants should be closed for in-restaurant seating dining and should be open only to drive-through or pick-up delivery options. Gatherings should also be postponed or canceled. This includes gatherings such as concerts, conferences, school sporting events, gyms, health clubs, theaters should all be closed. People 65 years in age or older with chronic health problems and are at high risk for serious illness from COVID-19 and are advised to stay home even if they don't have it. We're advising our community to practice social distancing and proper hygiene practices. That means wash your hands for at least 20 seconds with soap and water. Soap breaks apart things like viruses and killing them on contact with your skin. If you don't have soap and water, then use hand sanitizer with at least 60% alcohol. Social distancing helps stop and slow down this infection. Avoid close contact with people who are sick. Create a space at least 6 feet apart between people. You can prevent the spread of novel coronavirus, COVID-19, and protect other people in our community. Follow these steps when considering medical care. This helps hospitals and healthcare providers give the sickest people the medical care they need. Stay home. People who are mildly ill with COVID-19 can recover at home. People 65 years in age and older and those with chronic medical problems are at high risk for serious illness from COVID-19. They're urged to stay home even if they don't have it unless they need medical care. Call for advice. For medical advice, call your doctor. Try to get questions answered over the phone. Only go to the doctor's office or clinic if they tell you to. Seek care. If you are experiencing symptoms and need emergency help, call 911 if you think you might have COVID-19 infection. For additional resources, you can visit the Calaveras County Public website or go to our link for COVID-19, calling the Calaveras County Public Health Department at area code 209-754-6460 and visit our website. We're posting information there on a daily basis. We've been fielding some questions throughout the day from Facebook participants, and I have some questions that we've assimilated over the day, and I'll attempt to answer those here at this time. People ask very good questions. In fact, these are, I think, some of the basics. What are the symptoms of COVID-19 infection? The symptoms include fever of greater than 100.4 degrees Fahrenheit, measured with a thermometer, as well as cough and respiratory symptoms such as shortness of breath. What are the criteria to be tested? Testing is still in relatively short supply in our community, throughout California, and across the United States. So testing we want to reserve for people who are at high risk of having the infection and at high risk for complications if they were to get the infection. So if people meet that criteria that I discussed, which is fever, respiratory symptoms such as cough and shortness of breath, contact your medical provider. If you're a candidate for testing, that can be arranged. But then again, testing is reserved for people at this time with more serious complications and more serious symptoms. And as testing capability increases, then it would be the case that people who are interested in getting testing would be able to get it. What's the process and protocol to be tested? I think I covered that. If you want to be tested for COVID-19 infection, then contact your medical provider. That's your initial gateway to be evaluated and to receive testing. What if you don't have a primary care physician? What if you don't have a medical home? If you feel that you are ill, then you may need medical attention in an emergency room or an urgent care clinic. It's best to call ahead, letting them know that you have symptoms that could be consistent with COVID-19, influenza, or other infections, in which case you'll be asked to put on a mask and to wait until you could be seen so that you're protected from preventing illness to other people. Why are schools closed? Children, we know, may not be at risk for the higher complications of COVID-19 infection were they to get it, but schools are a breeding ground for transmission of the illness, and then children can take it home to adult members in their family who may be at increased risk. That's the rationale for school closure. Why aren't daycare centers being closed when regular schools are allowed to be open? Well, daycare centers oftentimes are necessary for parents to be able to continue working, and daycare centers, we've determined, are a more essential function and have been allowed to continue at this time, although some daycare centers like Head Start have chosen to close voluntarily on their own. How many tests does our county have? Well, like everywhere else, as I described across California and America, there is only a finite amount of testing supplies, specimen collection kits, and test laboratory capability. And in Calaveras County, we have testing for people who need to be testing to prevent the spread of this illness in our community. And we want to keep it that way by screening people who are interested in testing and trying to reserve it for people who really need it to protect the most vulnerable among us. What is the plan if numerous people get sick? The hospital's so small and doesn't have the resources or staff. Well, that's a very good question. In Calaveras County, we have one acute care hospital, Mark Twain Medical Center, which is licensed for 25 beds. The hospital also has 6 intensive care unit beds. Most of the time, the hospital is approximately 70% full, which on a normal day doesn't leave a lot of excess bed capacity. What do we do if people start getting sick and require hospitalization and intensive care? We've been working with our local hospital for years, devising plans for just such an occurrence. There is surge planning where the hospital can increase its capability to care for patients in other non-traditional parts of its hospital that it doesn't normally care for patients, such as classrooms and educational spaces. You may have, if you've driven by Mark Twain Medical Center, noticed a large yellow tent in the parking lot, and the hospital can increase its capacity to care for patients in the event of an emergency, and we have plans in place to be able to do that. One of the best ways to make best use of the hospital capacity that we have in our community is by delaying the number of cases that might present to the medical care system all at once. A lot of people have seen those curves, and what we want to do is flatten that curve. And by that I mean that if we can institute the measures that we're advocating for now, social distancing, closure of all of these mass gatherings, community events, schools, we can delay the transmission of infection, we can delay the onset of sick people presenting to the medical care system and overloading it to the point where the people that we do have getting sick will be able to be cared for. If we can stretch out and extend the duration of this illness, the medical care system will be able to absorb those people who may need care in the event of COVID-19 infection becoming more widespread in our community. We've never put through with this with the flu, no matter what the strain. Why now? Well, I think that question means is that why hasn't anything like this happened before? We've had bad influenza seasons in the past, and we haven't shut schools down. We've had bad influenza seasons in the past, and you've been able to go out to restaurants and bars. Why is this different? Because we haven't seen anything like this before. And I've been involved in public health for over 20 years, and we've never seen anything that threatens the health of the community like this. And these measures are necessary now to prevent the spread of this illness, increasing case counts, and the overwhelming of the medical care system. And that's the reason why this is different. This is a novel coronavirus, and by novel we mean it's new. It hasn't been seen before, and there's no protection or immunity in the population to it. And that's what makes this of greater concern to the health professionals such as myself, is that this is something that we haven't experienced before, and there's no immunity in the population to it. Are stroke victims more likely to get COVID-19? They might not be more likely to get it, but if they do get it, they may be more likely for complications from it, such as hospitalization or even death. So stroke patients, patients with other chronic illnesses, and just even the elderly are at increased risk of complications from COVID-19 infection if they were to get it. It looks like these other questions have been covered in the information that I've presented. We may have more questions coming in as I'm speaking. If that's the case, then Jessica will tell me.
There are just a few. Are there any plans for a drive-through testing?
The question was, are there any plans for a drive-through testing clinic? In order to do that, we, number one, have to have the testing supplies, and number two, there has to be the need. So as I talked about at the beginning of this presentation, we've had 2 cases of COVID-19 infection in Calaveras County with no example of community transmission taking place. That means we know where these people got the illness from, and there hasn't been new cases in our community that can't be explained through travel or exposure to a known case. For that reason, without community transmission, we're waiting until there's more prevalence and more accessibility to testing supplies and testing capability before recommending that. But that is a strategy that I'm in favor of, and once we have the ability and the capacity to do that, we would like to roll something like that out. It may not be a drive-through clinic per se, but we do want to encourage testing and get testing out there to the community so that those who feel that they are at risk or feel that they are symptomatic can get access to testing, and we're working on that as time goes by.
Is it okay to go to the park and for a hike?
The question was, is it okay to go for a hike or go to the park? Yes, those activities are not only okay, but those are encouraged. We want people to continue to be out and get fresh air if they can. We want people, however, if they pursue activities of like that, to be diligent on maintaining social distancing. Social distancing is the concept where you have at least 6 feet between you and other persons in order to prevent the risk of transmission of the illness. So if you want to go for a hike or a bike ride or a walk, you want to walk the dog, not only would it be okay, but it would be a good idea to get some fresh air, and I think it would be good for our mental health during these stressful times to be outside and get fresh air. So yes, I encourage that with the caveat of maintaining social distance at all times.
Will Calaveras be required to shelter in place at any time? And if so, how much notice will be given to people, and who directs that order?
Right now, the question was, is Calaveras County moving towards something called sheltering in place? Right now in Calaveras County, the recommendation is for people to maintain social distancing. We've eliminated or discouraged groups of more than 250 people, groups of under 250 people, all the way down to 10 people have been discouraged from banding together without the ability to maintain social distancing. We've recommended closure of schools, of bars, of wineries, of nightclubs, all of the things that I've talked about before. Restaurants, dining in at restaurants only for takeout and for to go. So that's the recommendations right now where things stand in Calaveras County. You may hear about some other larger communities like the San Francisco Bay Area, the city and county of Sacramento recently, earlier today, have recommended something that's called a shelter-in-place directive or a shelter-in-place order. What that means is that's a higher level of recommendation to the point where it's a directive or may even be a legal order by the local health officer, by myself, in conjunction with our emergency response partners to put something like that into effect. We haven't decided on that right now for Calaveras County. We're seeing what our neighboring communities are doing. We're seeing what the medical health need is for that based on disease occurrence in our community. And we're going to be discussing whether to move to that more strict level of prohibition of activities in our community, but we haven't decided that yet.
I think that's all.
Okay, no more questions are coming in. I appreciate viewers that are watching this, and your diligence on continuing these social distancing measures is very much appreciated, and it's up to us to do what we need to do right now. These are difficult times, and they're not going to go away soon. These social distancing and community mitigation strategies are going to need to be in effect for the next several weeks and even months. So your continued participation and cooperation with these directives is going to pay off in reducing the burden of disease in our community and protecting those among us who are the most vulnerable. So thank you, and more information will be forthcoming in the near future. Thank you.